Hello, I'm Helga Pile and I'm Deputy Head of Health here at UNISON, and I'm here with Yvonne Coghill, who's Director of the Workforce Race Equality Standard Implementation Team at NHS England. We've also got on the line Kebba Manneh, Chair of our UNISON National Black Members Committee, and Margaret Greer, UNISON's National Officer for Race Equality. And we're discussing today the disproportionate impact that COVID-19 is having on Black staff in the NHS across the UK. And obviously this is starkly illustrated by the number of staff who've died as a result of the virus, but also we know that many Black staff are suffering severe illness from it, are dealing with it in terms of their family members and their communities, but also even wider than that, just the sheer levels of anxiety and stress that this pattern is causing for staff across the NHS. So we know there's a lot of work to look at the data and analyse some of the reasons behind it. But it's really welcome the fact that the NHS has started talking across the UK about instructing employers to take action here and now to assess and reduce the risk for staff, but also to seek to engage with Black staff about their concerns and the wider issues, the structural issues that this is putting in the spotlight. So we know that immediate action on that risk is really important and should be done sensitively and meaningfully, not just to be a tick box exercise. So we in UNISON have issued some urgent advice to our health branches about how they can support that and do that risk assessment work with employers. And we know from our race equality campaign work that many line managers, that this is going to be a challenge. They've not necessarily got the time, the training, the confidence when to tackle issues of racism, and they often don't have that backup from their leadership. So we're hoping this short conversation today is going to be a useful way for members to hear a bit about the work that's going to be happening and think about how you can participate in it. So Yvonne, I'm really delighted to have you with us. Many people watching this will know you because you've spoken at our UNISON Black Members Conference and other events, and you're leading some work around these issues in England. Could I ask you first, just for your comments around, there's been a lot of discussion about some of the ways of understanding this data and a lot of focus on things like genetics and socio-economic factors. But what do you think is kind of missing from the analysis so far, and why does that matter for the NHS workforce?
Okay, first and foremost, thank you so much for inviting me. I'm really pleased to be here and to be able to talk to colleagues and members about this really important issue. And secondly, I'd like to say how very, very sorry I am for anybody out there that has lost somebody during this awful, awful time. I think we're all struck by it. It's all, really very, very difficult for people, whether they're from white or Black backgrounds. It doesn't matter. It is a really, really tricky and difficult time. I think the issue for Black and ethnic minority people is a really hard and difficult one to comprehend. And there has been a lot of talk about why this is, people living in houses of multiple occupancy, they have high levels of comorbidities, they perhaps have, are workers that are going to be facing the viral load much more than other people because they are in lower paid jobs. So all of that is true. But the thing that is really not being spoken about as much as it should be spoken about is the levels of stress that Black and ethnic minority people have to endure in their everyday lives. The life of somebody from a Black and minority ethnic background is not the same as the life of somebody from a white background. And, we have so much evidence now to show that discrimination, racism, being hyper vigilant all the time about what you say, what you do, how you go about doing it, actually has an impact, a physiological impact on the individual and their life. So what I'm saying is that age doesn't only just capture the length of time you have been alive, it captures the experiences that you have in that time. And if the experiences that you have in that time aren't always good experiences, what happens is that it actually shortens the length of time that you live. So we know that, for example, that Black women live on average 7.5 years shorter than white women. And we also know that you're more likely to lose your baby if you are from a Black and ethnic minority background. Indeed, you're more likely to lose your life, because we had the Embrace report a couple of months ago actually highlighting that in this country. The issue of stress and the levels of stress that lots of Black and ethnic minority people are under is not spoken about as much as it should be. The fact that you are hyper vigilant, and an example of that is that you have to wonder, I'm going to walk into this room, I'm going to be the only Black person, is it going to be okay for me? Are they going to accept me? Am I going to be speaking in the right way? Do I look like the right sort of person? All those things that you're thinking, it means that there's an additional energy that you have to expend that the white person doesn't have to. They don't have to think about that. I mean, an example is, when I go looking for properties, I always wonder to myself, I wonder if they'll want to sell this house to me because I'm a Black person. I wonder if they'll want me to live in their neighborhood. Those types of thoughts, which people will think, that's just a small thing, but it's cumulative, and constantly living under that level of stress is what weakens people's ability to fight off disease. It weakens people's ability to be able to live their lives in a way that is completely stress-free. And so, yes, lots of Black and ethnic minority people are in low socioeconomic groups. Yes, I get that. I know that some of us live in houses of multiple occupancy. But when we're talking about this thing called COVID, the first 10 people that died that were working in the NHS were doctors. And by no stretch of the imagination can anybody say that they would be living in poverty. I don't think there's any such thing as a poor doctor. And that sort of alerted me to the fact that this thing is very real, that stress and living in a society that is dominated by people who haven't necessarily built the society for people from ethnic groups actually has impact, and that impact has proven to be lethal.
Absolutely, I'm sure a lot of people watching this will really resonate with them. So I just wonder, in terms of the immediate kind of instruction that's gone to employers about risk assessing their Black staff, how do you think that needs to be done so that it can actually take all of that into account and be a meaningful process?
Well, I was really delighted and pleased when Simon Stevens, to the Chief Executive of the NHS 2 weeks ago, sent out a letter saying to all the staff across all the NHS that actually they should be taking extra care and being vigilant. In the absence of any hard data, you should be vigilant based on the data that we were getting. And I thought that was really very good of him to do that, because I know that there was a lot of pushback about, well, we haven't got the evidence. Well, the evidence is that people are dying and getting increasingly more sick. So I think that the evidence was there. And so the letter went out prior to the risk assessment documentation going out. So some organisations, some really good organisations like the one down in Somerset, actually took the issue into their own hands and decided that they were going to develop their own risk assessment processes, which is brilliant. I mean, the fact of the matter is, our NHS senior leadership and our managers have a responsibility to make sure that every single member of staff, it doesn't matter who they are, is kept safe. So, if you're leading an organisation, your job would be to make sure that all of your staff are safe. And in situations like this, you should be thinking, well, let me make sure that we have adequate personal protection equipment for everybody. Let's make sure that we've got the social distancing in place. Let's make sure that we've got adequate hand washing facilities. Let's make sure that we have all those basic things in place so that everybody feels safe. Because if people don't feel safe, they're not going to be able to give of their best to patients. And furthermore, they're going to worry about their own physical health, and they're going to worry about taking, you know, the virus back home to their families, which is not fair, it's not right, and it's just not appropriate. So when the letter went out, I thought that was great. So that was like a red flag to people that something needed to be done. Since then, the guidance has gone out, and I'm hoping that people have had the chance to read the guidance. And the guidance is very clear. It is about making sure that organisations have those conversations with people that are deemed to be at risk. And if they are at risk, they have a responsibility to shield those people, to make sure that those people are kept safe. And kept safe for all the reasons that I have said. It's really important that people feel comfortable going to work. It's really important that people feel protected and valued and appreciated in their everyday work, because if they're not going to be able to do their jobs to the best of their ability. And at the moment, we need everybody to do the jobs to the best of their ability. And if that isn't happening in your organisation, it's very, very, very clear. You need to contact somebody in your union or somebody that you can talk to about the fact that you don't feel safe and that you would like some help and support with that. It's as simple as that.
Absolutely, thank you. I think that really shows the role for UNISON and other unions in that. I wonder, Kebba, if I could bring you in at this point and just ask you a bit about, as a health worker and a union rep and chair of our Black Members Committee, what you're seeing as the biggest areas of concern for members at the moment.
Thank you very much, Helga. Before I come on to say what I think the concerns are and what we can do about it, is that I would like to pay heartfelt tribute to all the frontline key workers who have died as a result of COVID-19. It's very important to do that. Very, very close friend of mine, over 20 years, worked in the cancer ward and died as a result of it. And we feel the pain and we share the worries of their families left behind. That's very important to say that, because many of those families are facing financial challenges, which has not been discussed yet. And I think as the main wage earner lost to coronavirus at the front line, I think it's important for that to also to be brought to light. And hence, we in Unison started the campaign to fast track the pension payment process so as to help the families facing financial challenges to get some sort of help in that regard. I then will go into echo the Yvonne's analysis she put forward, very factual, very true, and is nothing else that I can add to it except to make a point of observation, which is simple and straightforward. We went into coronavirus has very, very unequal society. And there's no doubt in my mind that we will come out of it as very unequal society. So the point here I'm making is that the virus has shed a bright, bright light on how society was really like, and everyone can now see that that bright light has really undone the veil of rhetoric that has been happening all along. And people can clearly see something has to be done about health inequality, like Yvonne mentioned, poor housing, low income, and so on and so on. I can go on and on and on and on, you know. And the point Yvonne mentioned about when you're buying a house, moving to an area, and other, they are very, very real. They are. We experience it as a Black person living in a rural Wales here. I know that. And I think it's very important for everyone to actually say, well, what is that thing called? That thing people take for granted, that thing Black people cannot do. And I simply call it white privilege. You know, so people might call it others, but hey, I'm a Welshman. I call it as it is. It is white privilege. So therefore, it's very important to understand that and to say, okay, how can we deal with this? How can we responsibly take it forward and here and now to stop any further death from Black workers or the frontline key workers? And I think, you know, again, everyone talking about fast track, what do you call the risk assessment? And that is fundamental key in that we started that here in Wales with my own employer. And our branch, we've been calling it out to say something has to be done. We cannot just fold our hands and wait for God, you know, great God to come from sky and make everything okay for us. We've got to do something as Black people. So we organized and we went and see our manager and say, we got Equality Act 2010, which has EIA, Equality Impact Assessment. In England, I don't think you have that, but in Wales, we have that, and we still got the Wales specific duty. So we directly liaise with the Wales government and to say something has to be done here and now to stop any further Black passing or frontline workers with underlying health condition to be addressed here and now. Well, how do we do that? Risk assessment, risk assessment, risk assessment. My employer said we got approximately 16,000 employees in Aaron Bevan University Health Board. I said, yes, that's good. And so how do we, well, firstly, you have to identify where Black staff are or key frontline workers. So you identify them, then here's the form. Let's look at it together. We look at the form. It's very simple, straightforward. It took me, Helga, it took me 2 minutes to complete the form. And on that form, you just have to identify who you are, where you work, with your staff number. And then you go down the form, it has everything like if you age, you get a point score. If you got high blood pressure, you score a point. If you got diabetes, you score a point. And at the end, you add the point, and I add the point with my line manager. And I'm talking from experience here. We add the point with my line manager, and she said, thank God you are working from home. Because if you are at our Neverhall Hospital or where you would have been redeployed if it wasn't for your underlying health condition, we would have to find something or seal you from working in our wards here and now. So that's good. So it can work. We know it works, and we know the Welsh government with our regional secretary, we push that forward for Welsh government to make sure every single employer is taking action to stop it happening, to stop any further death. And liaising with our colleagues at HQ, Margaret to be precise, I hope she don't mind me saying this, we can replicate that approach to all the 12 regions in UNISON, and to say to each regional secretary, work with your colleagues, work with your any other employers that you covered, and tell them that they can do something about this. Because at the end of the day, what is important here, I'm telling you, Yvonne, that I put another hat on. I'm a senior presiding magistrate. And when I'm in court, and a chief officer is being brought because they breach health and safety rule, which, as you know, they can be prosecuted for it. They come in front of me in court. That is the starting point in England and Wales, the magistrates' court, to decide what we call murder trial. And at the murder trial, you plead guilty or not, and then we set the scene there. Then my question to the chief officer in the past was, what did you do that is reasonable and practicable to stop Black people dying? What did you do that is reasonable? They can't just say, I did a risk assessment. Yes, what did you do with that? Did you put it on top of the shelf? Did you action? What action did you do as responsible chief officer to ensure death don't occur? That is your, and if they couldn't produce any evidence, which on this occasion, it never did. So the next process for us to do is to say that there is no evidence in which to dismiss the case. Therefore, the case will go to the Crown Court to face judge and jury. So again, you know, hearing that Sir Simon Stevens send a letter out, he's taking a reasonable, reasonable step to ensure, well, I have taken a reasonable step, I have instructed X, Y, and Z to happen, which we welcome that, and that's good. And we are at the next stage of it. What, as a chief officer of an organization, what did you do to ensure that is reasonable and practicable? And I'm saying that include us in UNISON as well, because we got staff. Therefore,
Brilliant.
it's very important for us to get our house in order and to do this risk assessment as a priority work for UNISON. I think that's very important. And from a National Black members' perspectives, that's what we're going to push forward as part of our work program to ensure all the 12 regions in UNISON are on board, but not just on board, but they are taking reasonable steps that's practicable to ensure lives are saved today, not tomorrow. On the 12th of May, our General Secretary, Prentice, said that, safety of all workers is the bottom line of UNISON. Therefore, we have to take that seriously and say, Mr. Prince, thumbs up, well done. That is our bottom line on the National Black Members Committee as well. I hope that's helpful.
Thank you very much, Kebba. I think that's really, really important. You've laid out there. It's the immediate action that UNISON reps have got a massive role to play in making sure that this happens everywhere and happens quickly. So, Margaret, I wonder if I could turn to you now and maybe just broaden it out a bit to think about let's focus our efforts on getting that risk assessment process underway, but also thinking more widely about how Black staff can have a real voice in not just the immediate actions, but what this actually has shown for some longer term work that needs to be done and how Black staff can have a voice in that. And I just wondered what you think about the best ways that that can happen. I think there'll be an immediate sort of focus on talking to Black staff networks. Some employers have them, some don't, and some are more or less effective. But what do you think makes for a good network, and how can we use both those organisational networks, but perhaps other mediums as well, to engage in this wider conversation that this needs to take place at the moment?
Okay, thank you guys for inviting me to speak, and I'm really pleased but kind of like taken aback in terms of having to be here talking about something that has so fundamentally affected our communities across the board. And I really want to emphasize it's affected everyone across our communities, but obviously this webinar is about Black members. I know it's mentioned in terms of Black and ethnic minority, but I'm going to use the political term of Black communities. And really, in lots of ways, the starting point has to be, well, have Black members' voices been heard throughout the years? And I know in terms of UNISON, we've got a lot of data, a lot of information. We've got some really fantastic work going on in terms of our self-organised groups. But we're at a crossroads where we're having to think and work differently in terms of communicating with our Black members, because we are social distancing. We are not able to actually meet in a format that we would normally meet face to face. We're doing these webinars as we do, but it's some of our members who are in lower paid jobs, haven't got access to computers, network, webinars, Facebook, social media. So we're now having to think really outside of the box. How are we going to ensure that we immediately look at the risk assessment stuff that we've been talking about, but how effective that is going to be going forward in terms of Black members? And I think both Kebba and Yvonne have stated that members per se are scared, they're stressed, they're frightened, they can see their colleagues and family members losing their lives. I've also experienced that, so I know fundamentally how difficult that has been. We see people having to go to funerals, on their own. So it's really about how we, as UNISON, can communicate with our members, letting them know that we're here, we can be contacted, how we send out that message in terms of being contacted. If they're not in a union, they should join a union. When we in ourselves can be waiving our 4-week rule, because this is a crisis that we need to be able to support them with immediate action. And I would agree that if we've always talked about, racism ruins lives. So we need to kind of stop and think and have a critical review of how we as an organisation, but also how the government's action in relation to COVID pandemic has disproportionately impacted on Black communities, as well as people's human rights with regards to the lack of action that they have taken. So for me and for the chair of the National Black Members Committee and us per se, this is the great opportunity and time to really readdress the imbalance that has been taking place in our society. And I don't want anyone listening thinking that this is just going to be around Black members and how we support Black members. This is about how we support members, how we support our communities going forward, because the template that we use for the disproportionate impact on Black members who have died will be the same kind of template that we would use across the board for all communities who have disproportionately been impacted by COVID-19. So that's the kind of message that I want to give at this moment in time. So I hope that's helpful.
Thank you very much, Margaret. So I think we're running out of time, but maybe I could just ask Yvonne if you've got some kind of any words of advice for any member of Black staff who's watching this, who's going to work tomorrow and potentially facing that risk and that. What's your advice to them in terms of their immediate actions, but also more widely about having a voice?
So I think it's really important for people who have a voice like myself to actually say to members, you have a responsibility to keep yourself safe. You are a mother, a daughter, a sister, a brother, a husband, a wife, you have your family. And what has to happen is that you have to feel safe going to work. Your employer has a responsibility to make sure that you are safe, that you have the appropriate equipment, that they put systems and processes in place to make sure that you are safe. If you are in a situation where you do not feel safe, you have the right to actually say so, and you have the right to say why, and you have the right to seek support and help from your union or anybody else that can help you. This is your life we're talking about here. So this isn't about being shy or being scared or being, frightful or frightened. You have to take some responsibility to make sure that you feel safe as well. And the employer has a responsibility to make sure that that happens. And I think from a wider perspective, the government has a responsibility to the NHS. The NHS has a responsibility to its populations. And we have to work together to make sure that all members of staff, whether they are cleaners, cooks, porters, nurses, doctors, it doesn't matter, are safe within the environments that they're working in.
Thank you so much. Kebba, any one line of advice from you just to round off?
I know you will say that, Helga. And the one-liner is that I have got anecdote evidence, but it's very important principle because none of us mentioned them now, which is our members from the migrant workers community, especially the Filipinos, are telling me from all over our region that they are scared to speak up for fear of losing their jobs. That's very important to say that, and they want me to speak for them.
Yeah.
They said many of them have asked for PPE when the virus first struck, and they were not given a PPE. And I'm going very brief on this because I could go on a bit just to make the link with the round 2 of Windrush scandal, because this is the bottom of it. They are fearful to speak up because if they speak up, they will lose their job. If they lose their job, that's going to have not just a negative impact on them and their families here in UK, but overseas in Philippines, because the whole family back in Philippines will put money together to pay for the visa, to pay for the work permit. That work permit has a condition attached to it, and this is very important. I didn't know about this until they tell me themselves. That condition is that if you lose your job, you get deported back to the country of origin. So in other words, they are locked down to an employer who recruit them. They're locked down. They cannot change employment or employer because of more money or something else, because they're locked down. They lose their job, they go back home, because that's Theresa May's Home Office brought that law in to say that, you know, you get locked down with your employer. If you lose your job, you go back home. No ifs, no buts. And they know has happened to some of their colleagues. And when you get back home, that has a cultural implications for them, but not just cultural, but monetary, obviously, because every family member chip in, knowing that you send money home and you help them. So that is very important to say. They asked me to relate this to you guys, which is that it's not simple as I'm not going to work with COVID-19 patients because I haven't got a proper PPE. He said, that's why the death toll in our community, we will go and work because we're going to be sacked. If we sack, we bring same home, and also the financial consequence for the families at home is so huge that we have to go and work. Please tell everyone about this. We are locked down, and the government has the power to unlock it. That means they have to repeal the Immigration Act that bring that in. They can repeal it. Boris Johnson can repeal it, and we are calling for that legislation to be repealed so that people can be free. They can change employment. They can change. It's so important for the government to repeal it. Thank you.
Thank you very much. A really important reminder there about this is not a homogenous issue. There's the whole. We need to respond to all the different aspects, including the hostile environment, and the point you made really powerfully there about people fearful to speak up who are in that position, and that's the role for the union. Margaret, any final word from you before we finish?
Well, I think it's clear in terms of what both Yvonne and Kebba said. If you're not in a union, you need to join a union. You need to make your voices heard. Now is not the time to shy away from that. Black Lives Matter. We should be valued, and people should get all of the support that they actually need. So if you're sitting there listening to this and you're hearing what's being said, you need to pick up the phone, or you need to email a contact, and you need to make sure that you're getting the support that you need, because this COVID is a killer, and it's killing Black people disproportionately, but it's killing our communities. And we as a union have a responsibility to actually support and save our members. And this is the first of many webinars, I'm sure, in terms of keeping that communication and contact going. So that's what I would say at this moment.
Thank you so much. Thank you. And so can I thank you all, Yvonne, Kebba and Margaret, for being here and starting this conversation. And thank you anyone who's watching this for giving us the time. And just make sure you keep in touch with your branch and all the information that will be on our website so we can go forward with this together. Thank you very much.
Thank you.
Thank you. Thank you.
Thank you. Take care.